Urine formation. So urine is formed in the nephron units as water and dissolved substances move between the vascular and tubular structures. So 3 processes are involved in the formation of urine, and they are the glomerular filtration, the tubular reabsorption, and the tubular secretion. So in filtration, urine formation begins in the glomerulus and Bowman's capsule. About 20% of the blood is filtered into the tubules, and the remaining 80% of the blood leaves the glomeruli by efferent arterioles and continues into the peritubular capillaries. Filtration occurs when the pressure on one side of a membrane is greater than the pressure on the opposite side. This pressure difference is called the glomerular filtration pressure. The rate at which glomerular filtration occurs is called the GFR, and it gives 120 milliliters per minute or 180 milliliters per 24 hours. So you excrete 1.5 liters each day. So what happens to the rest? So tubular reabsorption occurs. So most of the filtrate, approximately 178.5 liters, is reabsorbed in the kidney and returned to the circulation. Tubular reabsorption is the process whereby water and dissolved substances move from the tubules into the blood of the peritubular capillaries. Most reabsorption occurs across the proximal convoluted tubules. So the kidneys choose the type and quantity of substance it reabsorbs. So you have glucose, which is completely reabsorbed. 99% of water and sodium is reabsorbed. 50% of urea is reabsorbed, and creatinine is not reabsorbed at all. So what's not absorbed becomes urine. Reabsorption occurs through active or passive transport. For example, sodium is actively transported, and most diuretics block the tubular reabsorption of sodium, which blocks the reabsorption of water. So the excess goes into the urine, and the excess secretion of urine is diuresis. Then you have tubular secretion, and although most of the water and dissolved substances enter the tubules because of filtration across the glomerulus, a second process moves very small amounts of select substances from the blood into the tubules. This process is called tubular secretion. So it involves the active transport of potassium, hydrogen, uric acid, ammonium ions, and drugs from the peritubular capillaries into tubules. The secretion of hydrogen plays a crucial role in the acid-base regulation. So to sum up what we just said, filtration causes water and dissolved substances to move from the glomeruli into the tubules. Reabsorption causes water and selected substances to move from the tubules into the peritubular capillaries. And secretion causes small amounts of potassium and hydrogen to move from the peritubular capillaries into the tubules. So that is the urine formation.